Thank you, Kristen and Leanna, for all those great thoughts. And Leanna, every time you mention the word data, Dr. Keller perks up. So the more you mention data, as Kristen, as everybody will tell you, he gets very excited. Good morning. My name is Welcome Wilson Jr., and although I've had many opportunities over the years to serve the Houston region and the state of Texas, higher education has been a particular priority of mine through my involvement with the board of Trellis Foundation, Trellis Company, formerly on the board of the University of Houston Board of Regents, and now the Texas Higher Education Coordinating Board. I've had a chance to witness examples of skilled leadership in higher ed within the institutions as well as agencies. To that end, it is my pleasure to introduce two exceptional leaders of our state who will outline current landscape, opportunities for student success, and institutional responsibilities in Texas. My fellow Trellis Board member, Dr. Richard Rhodes, serves as president of Texas A&M Central Texas in Killeen. After his distinguished service as chancellor of the Austin Community College, president of El Paso Community College, and as a faculty member and doctoral degree earner from the University of Texas, Austin. So I'm not sure what you get when you cross a Longhorn and a River Bat and an Aggie and what that intersection looks like, but Dr. Rhodes definitely knows for sure now. Dr. Rhodes will be conversing this morning with Dr. Harrison Keller, Commissioner of Higher Ed, who has served the state of Texas at the Higher Education Coordinating Board since 2019. Dr. Keller came to the coordinating board from the University of Texas at Austin, where he was deputy to the president for strategy and policy and professor of practice. In addition to other faculty appointments over the years, Dr. Keller has also served as director of research for the Texas House of Representatives and senior education advisor for the Speaker of the Texas House. Since I'm here to testify that since Harrison's arrival, he has furthered the respect of the coordinating board with the Texas legislature, and so the coordinating board has benefited from his leadership, and I think the state of Texas has as well. So please join me in welcoming Harrison and Richard to the stage. Thank you.
You know, Welcome made a comment about being a Longhorn, a River Bat, and now an Aggie. And Chancellor Sharp said, anytime you address an audience, you have to start with, howdy. Okay. So let me kick it off and say, Harrison, can I call you Harrison and not Commissioner Keller now?
Yes.
Okay.
Always.
So, thank you for taking the time first to be a part of this opening session for the summit. It means a lot to us to hear directly from you. Second, I want to say thank you for your leadership at the Texas Higher Education Coordinating Board. You truly have changed the landscape and the perception of the Texas Higher Education Coordinating Board, and I, for one, truly appreciate what you've done for the state of Texas.
Thank you.
And I know that it's in your heart and your passion when we take a look at what it takes to make students successful. It's a holistic approach. It's not just what happens in the classroom, it's what happens outside of the classroom also. And we're talking about the mental health and wellness of our students. And you have been a champion of that long before the pandemic. And we thank you for that and understanding what it takes for students to persist and graduate and be successful members of our communities. So I'd like to take just a minute, but one thing, having worked at the community college and being a part of House Bill 8, I thought maybe first I could just ask you, how is the implementation of House Bill 8 going?
All right. Well, first, thank you for the kind introduction. It's great to be here with my friend Richard Rhodes, and also I appreciate being included in this discussion today. And I do feel deeply that the work that you're doing is critical, especially right now for our institutions and for our students. And so thank you. House Bill 8 is going amazingly well right now. So we made the decision with the policymakers and with the institutions that we weren't going to delay, that we were going to put this comprehensive reform legislation into implementation right away. So we had already started with the colleges working on rules before the bill even finally passed. The bill finally passed unanimously in the House and Senate, and all the recommendations were fully funded. We had emergency rules to the governor within 6 weeks of his signature on the bill, and so we are into implementation this year. Right now, we are working closely with the community college leaders and other stakeholders on the rules for this next fiscal year for FY25. In fact, right after this, I'm going to go into our Standing Advisory Committee and talk about weights and rates for this next year. We're going to make a number of important changes, but overall, this is really astounding to completely transform the community college finance system and to get it into implementation. So we went from almost all the funding based on seat time, on contact hours, to now 95% of the state's funding for community colleges is outcomes. Production of credentials of value with more, and if it's in the high demand field, students transferring, students taking 15 hours of dual credit or dual enrollment that apply to academic or workforce credentials. And that funding for credentials of value is weighted for student needs to recognize that students who are low income, students who come in who are not college ready, adult learners have higher costs that are associated with serving those students. Overall, for the non-Texans in the room, you should know that this was about a 30% increase in funding for our community colleges and for our community college students. And I really want to applaud Governor Abbott and our legislative leadership, our members of the legislature, for getting behind a new vision for how the state would support community colleges in a dynamic funding formula. So this is getting a lot of attention across the country. Several of you were at this big national meeting I was just at, and I'm getting there's a lot of buzz around the policy innovations in Texas, but I want to highlight this is a story about implementation as much as innovation in the policy design. We could not be where we are today. We could not be moving this fast if we weren't able to work in very close partnership with community college leaders across the state, and that continues. And that's why we're able to be so ambitious and actually put this vision into action.
Yeah. You know, and as I look back upon how it transpired, was I think the critical element to success was the inclusion of multiple partners in the planning and the design. And, you know, your leadership role in making that happen was incredible. And your willingness to listen along the way. So thank you for that.
Well, I promised when I became commissioner that I would not make everybody happy, but I would always listen. And I've delivered on both of those above and beyond. I think you can, right. So.
You know, so changing subjects and getting back to why we're here, talking about mental health and wellness, what do you see as the role of the coordinating board in making that a component of Talent Strong Texas and how we work collaboratively to make a change? You know, post-COVID, I was just a side comment. I was talking to one of the counselors at Texas A&M Central Texas yesterday, and so she was talking about the challenges of students of all ages. So it's not just the young students coming to us, but all ages. The challenges that they face that we had never recognized before. And some of it is related to technology and the changes, and a lot of it is coming out of COVID and this sense of isolation. But what do you see as the coordinating board's role?
So first, let me just underline a couple of points you just made that I think are really, really important for context of this discussion. So we had a serious issue pre-COVID. I'd worked a lot on student success, as Richard alluded to. We had worked together, and when I was in my old job at UT Austin, and he was in his old job at Austin Community College. So pre-COVID, already what we were seeing is that adolescents, this generation, looked far better on many, many measures than our generation did, in terms of like drug use, in terms of binge drinking, in terms of risky sexual behaviors, a number of different kinds of indicators. But there are two that stood out: prospects for upward mobility and mental health, especially around anxiety. We had a serious issue pre-pandemic, and then the pandemic hit us. And what I've heard from presidents and provosts across the state is, as we're coming through, as we came out of the pandemic, and we're still dealing with these issues, they've never seen so much demand for academic remediation, and they've never seen so much demand for mental health services. And nobody has a model. Nobody has a model for actually meeting the needs right now. We had an issue pre-pandemic, and it was dramatically exacerbated. And I've seen this with my own family. The kids are not okay, right? Things are not back to normal, and we shouldn't pretend that they are. We came through the largest disruption to our colleges and universities since the Second World War, and we're still feeling the effects of that. We're still feeling the effects of students being isolated from their friends, isolated from their teachers, losing ground academically. And so if your student is so crushed by anxiety that they can't get out of bed in the morning, that they can't bring themselves to go to class, it doesn't matter what your math program is. It doesn't matter how sophisticated the AI is that you're using or how high quality your instructional materials are, right? So if we're going to expect students to be successful, we need to meet them where they're at. We need to acknowledge the scale of this problem. And again, so that's why this conversation is so important. So now, what's the role of the coordinating board? So of course, you all know we have the largest coordinating board in the United States. We're about 400 now at the coordinating board. Of course, we have about 1.6 million students in public higher ed and 94 public institutions. Our role is to be a resource, to be a partner, and to be an advocate for Texas higher education. So when I became commissioner, one of the things we did right away is we set up a new division for student success, and we were able to recruit an excellent assistant commissioner for student success you'll hear from later, Jenny Elstrother. We got the innovators together and set up a new advisory commission for student success from our 2-year and our 4-year institutions. And so that's important, not just for hearing from the institutions, but also institutions don't naturally partner. Institutions don't naturally collaborate. Higher ed institutions tend to operate like little city-states, right? So you need context where you can get people together so you can share what we're learning and we're not making the same mistakes again and again. And also so we can identify the strategies that are going to be more likely to scale. And we were able, thanks to Governor Abbott and the legislature, put resources into setting up a new repository of our student success efforts. And with Ithaca S&R, now you can find online, we stood up in our OER Texas, there's a repository of the major student success efforts across all our public colleges and universities, and we're continuing to add to that, continue to build that out. The legislature also entrusted us with funding we can give out to grants to institutions to accelerate the adoption of evidence-based student success practices, so we can try to scale the strategies that look promising, so we can test ideas and share what we're learning across institutions. This is not how any other state is trying to advance their student success work. And again, we're able to do this because of the partnership across institutions, and with our policymakers, so that we can use resources more strategically to figure out what's going to be more effective.
Yeah. I think you've hit on some topics that are just so important, and that is the collaboration that's existing, and the sharing of information and knowledge, and the understanding that every single community is somewhat different, and the population that they serve can be very different. And I give an example of actually where I was at one point in time, El Paso Community College, and the population being in proximity to Fort Bliss and a large military population. And then you take a look at where I'm at now, right next to Fort Cavazos, and the dynamics of those two sites themselves and the relationship to the military population brings some different aspects to mental health and wellness. Yeah. That honestly you won't see in some other communities. But there are other communities that you're going to see some aspects that you wouldn't see in Killeen or in El Paso, Texas. And so I think, what you were just sharing is the fact that we can look at different circumstances and different locations and how we can benefit from that collaboration and that innovation that exists.
Yeah, I think that's really, really important. So within our institutions we're working with around student success, so there's clusters of institutions that are working on different strategies. And we reached out to some of the leading experts and organizations in the country and invited them to partner with us to help inform our discussions, inform our grant making. So we have a cluster of institutions that are working on student basic needs. If students are homeless, if students have food insecurity, then they're not going to. It's less likely they're going to be able to be successful, right? We have institutions that are working on leveraging data to guide their student success efforts and other strategies. But we also have a cluster of institutions that are working on student mental health and especially focused on that. And I do want to call out the Meadows Mental Health Policy Institute as our partner that we continue to learn from and deeply appreciate our partnership with them and with our institutions in trying to advance this work. But in education, folks tend to want to find like the solution, and then they say, well, then we'll just stamp it out in different iterations, right? And we'll just scale the solution. But to your point, like we've got to adapt these solutions to the local context, and what the way that we implement a solution in far West Texas is going to be different than the way that we do it in and around Houston. Right. So it's important that we've got sort of due humility and understanding, like what are the conditions that enable these more effective strategies to scale.
Yeah. You hit on a point that I think is so important too, and that is the relationship with various foundations or nonprofits, and to make sure that that collaboration exists, that we can learn from, like the Meadows Foundation, and that we can also collaborate with those in our communities. We've got somebody here from Boys and Girls Club, but it's the unique relationship between institutions of higher education, public schools, nonprofits, foundations, industry partners, all working together to address the issues. Because I know in visiting with some of our industry partners, this is not just an issue with higher education. This is an issue, mental health and wellness, an issue with employees.
Well, and on this and other issues also, I want to say how much we appreciate our partnership with philanthropy, in particular with the foundations. And several of them are represented here in this room. So we have the Texas Higher Education Foundation as our official nonprofit that works closely with the foundations. Melissa Henderson's our executive director. And so we have a regular heartbeat of conversations with philanthropy. And I think sometimes, honestly, I make Melissa a little bit nervous because we just share, here's where we are and here's what we're working with and here's what we're struggling with in student success and what we're doing in finance policy and data and other. So we have learned so much from that engagement with the foundations where they'll look across their national portfolio, their state portfolio, help connect us with other partners. So this is another important part of it is we have to, several of us were just at this education policy conference where people get up and they talk about what's working and celebrating what's working, and that's important, but it's also really important that we talk about what we're struggling with. We talk about what we don't know, and we share that so that we can accelerate where we're learning together. And that's something that I think philanthropy can be especially good at, is creating those spaces where we can come together and share what we're learning, what we're struggling with, and help us move together faster.
Yeah. I just have to say, Melissa told me earlier that you always make her nervous.
It's probably a common thread on the senior staff right now, I think, especially as we're coming in for, it's been the year of rulemaking. So there's a lot of rules coming to the board next week. I think everybody's feeling pretty nervous.
Speaking of that, what do you look forward towards the next legislative session, and how does mental health and wellness fit into as we move towards the next session?
Yeah. So we already have some tools in place. We've got a loan repayment program for mental health professionals. It's really important that we continue support for that. We need to acknowledge and own the scale of this problem. And that's true of us in higher education too. So with one breath, the higher ed will tell us, we're overwhelmed by the scale of the needs just on our own campuses and just in serving our own students, right? And then in the next breath, we need to talk about how we're owning that problem. Like, we are the ones who train the mental health professionals, right? And so I think that's where a partnership, first, sense of responsibility with the higher education institutions, but partnership with the policymakers to make strategic investments in we have a number of critical workforce needs, right? For nurses, for early childhood education workers, but for mental health professionals. Strategic investments to expand the capacity of our programs, to get behind our institutions, to get behind our students, so that we can meet the challenge. And that's something we have to take more responsibility for, but we also have to have the partnership with policymakers so that we can focus the resources and meet the need.
Yeah. And you've been very instrumental in creating those relationships with our legislators. That's a critical component because they listen to you, and that is so important in your position. But it takes champions in the legislature too, who will pick up the mantle and move it forward. And I have to take a minute just to point out one of those champions historically for higher education, for healthcare needs, for mental health and wellness, and that's Representative Donna Howard. So,
Also my state representative.
Yeah, she was teasing me earlier that I couldn't whistle, but one of the things you said when we were talking about mental health and wellness is some of our students have trouble getting out of bed in the morning because of the anxiety and the stress and the lack of feeling like they belong in institutions, and that they don't see a sense of purpose. And that's what I hear from some of our counselors. And to address those needs is just one of the most difficult times we've had. They
only gave us 20 minutes, so we're going to get that hook in just a minute. But this is a really critical point, just in general, that's something that we need to consider, is that we don't, the point isn't just like getting the students to feel better isn't going to address this issue about having more of a sense of purpose, right? And what we see with a lot of students is from middle school through high school, through higher education, like that we're just kind of doing school and we're kind of doing the next thing, right? Not enough sense of what we're equipping students for, and helping students think about, well, what is their purpose? What do they want their lives to be about? We are partnering with institutions in enhancing college and career advising, so there's more of a clear line of sight, not just to graduation, right, but to a healthy, fulfilling, productive life. And so that's an important part of our solution and our way through, is to have that broader sense of purpose and to help equip our students so they have a better sense of where they're going. But again, I so appreciate the conversation with you all. And again, I want to say how much I appreciate the work that you all are doing here today and at your institutions. Thank you.
So join me in thanking Harrison.